Hi, this is Dr. Eliana Aaron from EmaCare. I thought it would be helpful to give you a little bit more visual understanding about the epidemiological curve. So I know we've been seeing different charts everywhere, and I want to explain how that translates into real life numbers, and I'm going to try to show you that today. So I'm going to show you my screen here. And I'm sure you've seen this. This is the CDC. This has been shown everywhere. So basically, when you take a look at this, this is the number of cases over time. And then this is new cases over time. And then, this is cases, this is time. And then you have a certain level, which is the healthcare capacity. Okay, and every country has a different capacity. Every state, every county, every city, everyone has a different capacity. In Israel, for example, our healthcare system has always been ranked as the most crowded healthcare system in the developed world by the OECD. This is going on for many, many years already, where we are normally at about a 98% capacity. So if you're already at a 98% capacity, that means that you're already up here without coronavirus. So that's why it's very challenging when all of a sudden you have a pandemic and you have a lot more critical patients. And that's why Israel's being creative and taking over hotels all over the country to help treat people. And they're converting hotels into hospitals in order to do that because there aren't enough hospital beds in the country as it is. So basically, when you look at these curves, and I want you to pay attention because the next slide I'm going to show you is actually going to show you where countries fit into this. So without protective measures, what happens is you got exponential growth, and you can see the chart goes like very sharply up. This is, where the numbers are doubling every 2 or 3 days, and very, very quickly. Look how quickly this is. In the timeline of the disease, you can see that very quickly you meet capacity, and you can no longer handle. So this is when death rates really go up because you just don't have the capacity to treat people. If you're able to keep the curve lower, then you're able to still have the same number of patients that are infected most likely, but you're able to stretch it over a period of time so that the healthcare system can handle the amount of people who are sick. This lowers the mortality rate. This lowers the critical numbers that we look for. And it also means that when people are critically ill, it's more likely they're going to rebound and recover rather than die because there is enough equipment and there are enough people to take care of them. So that's the first slide I wanted to show you. The second slide I wanted to show you is, I'm going to share that with you right now. So here we have different countries and what their growth rate is. Now, this is based on total numbers of cases, and I want to explain that carefully. The first chart we saw had a curve up and down, so that represents new cases. When you're talking about total cases, when you stop having new cases, you just get a flat line because you're still at the same total. So when you look here at Singapore and at China, it's a pretty flat line. They're not getting a lot of new cases relative to what they had. So what you have here is a flat line, and we want to see everybody flattening on this kind of a chart. The angle of the rise is very, very important. So if you take a look here, we talked about doubling every 3 days. That's this line over here, okay? Now take a look how many countries are doubling within 2 to 3 days. It's a huge number of countries, and those countries are actually in trouble. Actually, let's put it this way. Everybody is, suffering and dealing with this illness. When you have doubling every few days, you get into some serious trouble, and that's where you start having problems. So I'm going to give you an example of why it's so urgent to turn this number and to turn this angle into an angle that is much further down on this scale. Because when you're talking about an exponential growth, let's say you're talking about doubling every 3 days. So what you're talking about then is 500 cases become 1 million after 11 periods of doubling time. So if it's 3 days, that means 33 days later, 500 cases has become over 1 million cases. So we don't, and that's really where, you know, by the time you realize how bad it is, it's almost too late to do anything because of the first chart, because at that point, everything is sort of crashing. You know, you don't have enough beds, you don't have enough respirators, you don't have enough people. So where does Israel fit in right now? So Israel did have the doubling every 3 days. We did have that for a short period of time. And now we're starting to flatten that curve. So what we have today, for example, is 5 days. So we're now, from the 3 days, we've now gone to 5 days. We don't want to be at 5 days. We want to be at no days. We want to be where we are flatlined and we aren't going anywhere. But 5 days is a lot better than 3 days. It extends the period of time that those numbers are going to double. So when you think about the difference between doubling every 3 days, that gives us 33 days to go to from 500 to 1 million. With every 5 days, that means that you have 55 days, so almost double the number of days to get that number even lower, okay? So that's really important to keep in mind. I really thought this would be helpful in just understanding when I send out the charts, so you understand how those curves work and the anticipated growth versus actual growth, that we're lowering that curve pretty nicely. So I wanted to share that with you. I hope it's helpful, and I hope everyone stays healthy, stays safe, and stays home. Take care.